Hello, I'm Dr. Michael Ozner, author of The Great American Heart Hoax, and I'm medical director of the Cardiovascular Prevention Institute of South Florida. Cardiovascular disease is the #1 killer in America. We know that men and women have an increased risk of death from cardiovascular disease, which is heart attack and stroke. And we know that this is a preventable disease. We don't have to succumb to a dreaded disease like heart attack, stroke, and vascular disease, but we do. I wrote The Great American Heart Hoax because we have a hoax in this country. And the hoax is that people with stable blockages in their arteries really do not benefit from stents or benefit from bypass surgery. These procedures, these what we call interventional procedures, are best utilized in the unstable patient in the throes of a heart attack or people with disabling chest pain. There's no data whatsoever to suggest that in the majority of individuals with blockages in their heart, doing bypass surgery or putting in stents will either prolong their life or prevent future heart attacks. No evidence of that. Yet, the good news is we have mounds of evidence that an aggressive prevention approach that I talk about in my book will not only prevent heart attacks and prevent strokes, but will slow the process of atherosclerosis. Now, we know that there has been significant advances in the field of vascular biology. It's not the 90% blockage that goes to 100% blockage that kills most Americans or leads to heart attacks. It's the 5%, 10% blockage that suddenly ruptures, leading to a clot in the artery that leads to sudden death and heart attacks. Part 2 of my book is a 10-step approach, and it begins with nutrition. We have overwhelming evidence that a Mediterranean-style diet with fresh fruits and vegetables, whole grains, cold water fish that brings omega-3 fat to the table, extra virgin olive oil, beans, nuts, foods of this sort can actually reverse coronary heart disease. It can do so by lowering cholesterol as well as lowering inflammation. All of the data that we have, the mounds of evidence, point to a Mediterranean diet, which is a non-processed food that is healthy and provides our defense. Also exercise. You know, the concept that we need to exercise for hours a day is incorrect. Simply walking 30 minutes a day can significantly reduce heart disease in the young and in the old. We need to get Americans moving. You know, stress is the forgotten risk factor. Everybody talks about cholesterol and blood pressure, but believe me when I tell you that stress is as important as these other risk factors. The next area is smoking cessation. In a word, if you smoke, stop. We know that radiation exposure in people that volunteer for CT scans, for instance, who are perfectly healthy just as a screening tool, you know, I have challenged that. And I say that the CT scan is important for a diagnostic tool in the emergency room or for people that have symptoms. But if you're not symptomatic, stay away from them because they expose you to significant amount of radiation. We also know that one should decrease chronic inflammation. Chronic low-grade inflammation leads to heart attacks, leads to strokes, leads to cancer. We also know that control of cholesterol, control of blood pressure, control of blood sugar is also important. I find that the average person doesn't get the proper screening tests, and the average doctor who orders simply a cholesterol, a good cholesterol, a bad cholesterol, and triglycerides is uncovering about 40% of those people at risk for heart attacks. There are new tests that have come along that can uncover 90% of people at risk. Why not get a stress echocardiogram, which is utilizing harmless sound waves, as opposed to stress nuclear studies that inject intravenously radioactive isotopes that increase our risk of radiation exposure and cancer. I talk about all these issues, and I feel that, in summary, We have the ability to prevent heart disease. We're only going to do it if we follow the guidelines that I've mapped out in the Great American Heart Hoax